determining the association of use of oral anabolic steroids and the occurrence of hypertension and cardiac conditions. Oral anabolic steroids are synthetic substances related to the male sex hormones. These should not be mistaken for the medical steroids which reduce inflammation. They promote the growth of skeletal muscle and the development of male sexual characteristics in both males and females. These anabolic steroids can exert strong effects on the human body that may be beneficial for athletic performance. It also produces increase in muscle mass and physical strength and are consequently used in sport and bodybuilding to enhance strength or physique. It is for these reasons that they are banned from being used in athletic competitions with the unfair advantage it provides. Another reason for its prohibition is the negative effects it has on the user. These include impotence, psychiatric disorders, and liver abnormalities. It is known that sports today have what is called a steroid epidemic. This means that sporting leagues around the world have seen an increase in users primarily to increase athletic performance. MMA, or mixed martial arts, is no different. Joe Rogan, an analyst and commentator for the Ultimate Fighting Championship, stated that over half of their fighters, relatively unknown or high profile, have used performance-enhancing drugs in one way or another. Some of those who were caught were Thiago Silva and Ken Shamrock. As such, due to the negative consequences steroids entail, both ethically and physiologically, usage of these steroids have regressed and even ended many fighters' careers. Our study would inquire then if one of the negative effects of usage would be the increase in probability of developing hypertension and cardiac conditions. We would like to see if there is an association between the two factors. This study utilizes the cohort study design. It is analytic, quantitative, and observational in nature. The study recruited 60 retired MMA athletes of both sexes whose medical histories are available and can be disclosed albeit anonymously. Purposive sampling was used due to the specificity of the study. Participants underwent medical examinations to determine if they possess hypertension and/or cardiac conditions. Review of records was conducted to note a history of use of oral anabolic steroids and other factors such as alcohol use and smoking history. They tested for hypertension using a sphygmomanometer and utilized an electrocardiogram for the presence of cardiac complications. The researchers utilized both descriptive and inferential statistics for this study and have set their alpha at 0.05 to ensure security and safety. They used measures of central tendency and the mean and mode and logistics regression to test for the strength of the association of the variables if it is present. Now with the results. Of all the athletes assessed, 51.67% or 31 of them were female, and 48.33% or 29 were male. Those over 60 were numbered 22, 36.67% of the sample. The most frequent age of the participants were those under 60, with 38 or 62% of the total sample. 25 or 41.67% of the sample were participants who did not smoke, while the other 35 or 57.33% have. Half of the participants have engaged in alcohol drinking, while the other half have not. 48.33% or 29 have been found to have hypertension, while 51.67% or 31 of the participants have not developed the complication. 27 or 45% have been found to have cardiac conditions, while 55% or 33 of the participants do not. For those who have taken steroids, they are numbered 34 or 56.67% of the sample, while those who haven't are numbered 26 or 43.33%. These are the combined data for all the male MMA athletes. These are the combined data for all the female MMA athletes. These are the combined data of all the participants. Now you will see in this graph that in every aspect, there are more MMA athletes who do not have complications or comorbidities, yet those who have taken steroids are greater. For the female athletes, unlike their counterparts, barring cardiac conditions, more are positive with smoking and alcohol history, as well as the prevalence of hypertension and steroid use. When combined, it can be seen that all the recorded data are more or less equal with each other. As seen in the tables and graphs, though there may be some variations between males and females, both sexes are still affected by oral anabolic steroids. Effects such as hypertension may occur. Using anabolic steroids can increase the probability of developing hypertension with the individual. Although this may be the case with hypertension, the usage of oral anabolic steroids have no association to the occurrence of cardiac conditions, and that, with its intake, it may also reduce the probability of developing one. After applying all the statistical tests and getting all the needed data, the outcome of the study implies that oral anabolic steroids have varying effects on the occurrence of hypertension and cardiac conditions, especially on the aspect of gender. Male MMA athletes can increase their chances of developing hypertension with usage of steroids, while lowering their chance of developing cardiac conditions. Female MMA athletes show no effect when it comes to hypertension, but data suggests that it increases their chance of developing cardiac conditions. Along with the ethical considerations, especially during competitions due to the complications brought about by steroids, they should only be used with a doctor's prescription and if there are no more alternatives. Due to the small sample size of the study, as well as the equivocation of the other factors smoking and alcohol has on the outcome, it is proposed that more research should be done on this study.